Welcome and good morning, good afternoon, and welcome to the Society for Digital Mental Health Conference 2026. On behalf of SDMH, the board, and our conference committee, I'd like to thank you for joining us today. Whether you're a clinician, researcher, student, entrepreneur, policymaker, individual with lived experience or advocate, we're excited to spend the next 2 days exploring the future of digital mental health together. At SDMH, we believe meaningful progress happens when diverse voices come together to share knowledge, challenge ideas, and accelerate responsible adoption of evidence-based digital solutions. Our mission is simple but critical in furthering a field of unified voices. So this year's theme, Future Forward, Navigating Change in a Digital Mental Health, reflects the moment we find ourselves in the field with a rapidly evolving landscape. From AI and emerging technologies to policy, implementation, and access, over the next 2 days, we'll explore both the opportunities and challenges shaping the future of care. However, before we continue, I'd like to take a moment to honor and remember Adam Goodkind. Adam made meaningful contributions to the field of digital mental health and to our community. Through his work, leadership, and dedication, Dr. Goodkind helped advance our shared mission and inspired colleagues, collaborators, and friends. We're grateful for Adam's impact and legacy he leaves behind. So please join me in a brief moment of reflection as we remember Adam. I see the hearts. That's wonderful. So as we reflect on those who helped build this field, we are reminded that our progress is made possible by the contributions of many individuals over time. With that in mind, I'd like to briefly look back at the journey of SDMH. While SDMH was formally established in 2021, our roots trace back to the Banbury Forum in 2019. What began as a shared vision among a small group of leaders has grown into a vibrant community of nearly 2,000 members. And as we celebrate our 5-year anniversary, let's see those hearts again, we're proud of how far we've come and even more excited about what's ahead. So over the past year, our community has continued to grow again, over 1,900 members, almost 2,000, and more than 4,000 LinkedIn followers. Through our SIGs, local meetups, and digital drop-ins, we're creating more opportunities for members to learn, connect, and collaborate. And that growth is translating into impact. Over the past year, SDMH leaders have delivered more than 30 educational presentations, contributed to policy discussions, engaged with federal agencies, released guidance on the responsible use of Gen AI in mental health care. These activities help ensure that the voice of the digital mental health community is represented in important conversations shaping the future of care. One exciting area of growth is our local SDMH communities. And I'd like to put a shout out here to Dr. Ellie Burgess for really spearheading and championing these activities. So this week, members are gathering in Pittsburgh, Oakland, Chicago, and Tucson, strengthening connections and continuing conversations beyond the virtual conference environment. So please take a note of that and join any of those if you can. Obviously, this conference would not be made possible without our sponsors. So thank you for your partnership and commitment to advancing innovation in mental health. We're also grateful for our exhibitors. Be sure to visit the virtual exhibit hall to explore these innovative products, services, and solutions that are help shape the future of digital mental health. You asked for it last year and we listened. So this year we've expanded networking opportunities, enhanced our poster gallery, introduced the virtual exhibit hall, and launched local meetups. This is all designed to help you connect, learn, and engage. So to get the most out of the conference, just a few quick reminders. Please create your attendee badge. This is required to use all of our networking features. Any session that you'd like to attend, just click the join session to enter the presentation. And don't hesitate to participate in discussions and Q&A. Some of the most valuable conversations happen outside of these professional sessions. I also want to remind you and invite you to visit the virtual exhibit demonstration from Mind Science Health tomorrow at 1:30 p.m. Eastern Time, and also visit the other exhibitors throughout the conference. They'll be showcasing solutions for all of us throughout the conference. We have an outstanding program ahead. So today's agenda are keynote presentation, flash talks, ask an expert, and collaborative discussions. We've also included substance use. We want to ensure that everyone feels included within our society. So there's truly something for everyone. At this time, I'd like to recognize our executive board for their leadership, vision, and commitment to advancing the mission of SDMH. I'd also like to thank our conference planning committee. This event represents months of preparation and coordination. And a special thank you to Tanvi and Tyler for their countless hours spent ensuring every detail came together. Thank you to our moderators who will help guide conversations for attendees, and to our volunteers working behind the scenes. Thank you so much for your time, your energy, and dedication. This conference would not be possible without all of you. So as we look ahead, SDMH remains committed to expanding access, improving outcomes, reducing disparities, and advancing evidence-based innovation. Achieving these goals requires collaboration across disciplines, organizations, and sectors, and that's why this community matters. So let's be in the room together. And with that, we will begin the conference. I officially declare the conference open. You can see the hashtags there. Connect with us. And most importantly, enjoy the conference, make new connections, share your expertise, and continue the conversations that will help shape the future of digital mental health. It is now my pleasure to introduce our keynote speaker. You all know and love him, Dr. David Mohr. Dr. Mohr is professor of preventive medicine at Northwestern's University Feinberg School of Medicine, with appointments in psychiatry and medical social sciences. He founded the Center for Behavioral Intervention Technologies, one of the world's leading digital mental health research centers, and is a founding member of SDMH. With more than 30 years of continuous research funding and over 375, peer-reviewed publications, Dr. Mohr has helped define the field of digital mental health as we know it today. His keynote presentation is titled Bringing Digital Mental Health into Real-World Care. So please join me, Lisa Palko, Executive Director for the Society of Digital Mental Health, which I did not say before, in welcoming Dr. David Mohr. Thank you, David, for being here.
Thank you. And now Let me share my slides here. Give me just a second. Okay, so that should be working. So thank you, Lisa, for that great, that really warm intervention, and it is intervention introduction, and it is really a pleasure. It's a pleasure to be here, and really an honor. So thank you. Before I get started, I need to make a few disclosures. So I've accepted honorary and consulting fees from Benchmark Health and OpenAI, and I have an ownership interest in Adaptive Health, which I will not be talking about today. And then I also want to acknowledge the funding we've received over the last years from the National Institute of Mental Health, for which I am very grateful. So what I'm going to cover today is, I'll give sort of the theme of past, present, and future. I'm going to just review briefly the scientific evidence for digital mental health treatments, the efficacy and the implementation. Probably most of you are familiar with that. And then what I want to do is really kind of broaden our view of digital mental health technologies and how I think digital mental health technologies are not just going to be providing treatments, but also supporting and improving mental health care delivery more broadly. Talk a little bit about the benefits and risks there, and then close with a little bit more on what SDMH is doing. I will try to leave a few minutes at the end of this for questions. So as we go through, please go ahead and put any questions that you have in the Q&A, and we'll get to as many of those as we can. So, digital mental health treatments started out with browser, 25 years ago or so, with browser-based interventions that were, a lot of it sort of putting PowerPoints on the internet, and then becoming more interactive. With then, as smartphones became available, we moved that to a new platform, the smartphone. And since then, we've seen a lot of work being done in virtual and augmented reality, SMS text messaging, and most recently, generative AI. Uh, and overall, the scientific evidence, I think, is really clear that it's no longer a question of whether these tools work. We have an effective class of treatments, of digital mental health treatments. For common mental health problems like depression, anxiety, PTSD, there are now hundreds and hundreds of trials, well conducted, randomized controlled trials showing strong effectiveness. And there have been some trials comparing the digital mental health treatments to psychotherapy, and they have generally shown equivalence. Most of the literature suggests that these tools are stronger when supported by some human, a therapist or a coach. Does not need to be a therapist, so we can train coaches. Not all studies have shown that, and I think a couple of caveats. I think it depends in part on the design and the platform that's being used for the treatment. So certainly AI, as we'll talk about in a minute, may not need that. But that is an important. I think the human involvement is important, and I'll be talking a little bit about that. And then there's also a growing literature on digital mental health treatments for severe mental health, like bipolar disorder and schizophrenia. And there again, we're seeing it's effective, primarily used as an adjunct to treatment, to other care. So things like coping skills training or cognitive remediation training for schizophrenia. So, generative AI tools in the last few years have become available. I think everybody here is familiar with the general tools like ChatGPT, Claude, Gemini, and surveys suggest that around half of all Americans with mental health problems who use generative AI tools are also using those tools for mental health support. And these tools aren't designed for that purpose, and that creates problems like inaccurate. They can provide inaccurate or dangerous advice, partly because they're sycophantic. So, agreeing with people that they should stop using their medications. There's been a lot of reports in the press, as well as lawsuits around suicide, where chatbots have facilitated or encouraged suicide. They can validate, and reinforce delusional thinking. Use of these tools, can also, for some people, increase social withdrawal and dependency. And of course, there are privacy and security issues. And so, there are now more and more AIs being used more and more specifically using foundational models for mental health that are more specific that, hopefully can mitigate some of these problems. And I want to talk just briefly about what I think to date is the largest and best trial of a generative AI tool called Therabot that was developed by Nick Jacobson at Dartmouth. And so, this trial, it compared Therabot to a waitlist control, and interestingly, they allowed people to enroll who showed evidence of depression, anxiety, or eating disorders. So not just one problem. And over 8 weeks of treatment, they saw improvements that really are comparable to what you would see in any psychotherapy or behavioral treatment. Satisfaction was very, very high, and engagement was really strong. So over 6 hours, which is 6 hours is essentially the dose that you might expect for 8 weeks of face-to-face treatment. But even here, there were some risks. So all of the Therabot messages were reviewed before they went out, and I don't know if this is accurate, but I did a back of the envelope kind of calculation and figured that there were around 26,000 messages that went out, and the staff, reviewed all of them and corrected problematic messages. And so there were 15 times that messages went out that had, that were concerning around safety, and 13 times for inappropriate messages like, providing medical advice. So that may not seem like a lot, but there were a little over maybe 110, 120 people in the treatment arm. So even in this carefully designed product, there were some problems, and there have been other reports like Kate Stamatis, I think recently had a publication coming out of Slingshot where they reviewed these kinds of messages and saw, definite improvement, definitely better than general purpose, but the problem still remains. And so this places us, I think, in our field of kind of looking at a cost benefit, because clearly the benefits are enormous. There still are some risks. I think these risks are going to improve over time. We are getting better. We are getting better, and I think these kinds of tools have huge promise for the future. I want to, and then just, cost effectiveness. There have been lots and lots of studies on cost effectiveness over the years, and meta-analyses of those studies. And overall, it looks like there's around a $250 a year cost savings per patient in a healthcare system. So I want to move now to just review implementation. So, Lisa kind of mentioned that when we founded the Society for Digital Mental Health, we intentionally founded this as a big tent organization, including people from industry, from healthcare systems, researchers, payers, because we need everybody at the table, I think, to solve the kinds of problems that we're facing in this field. And one of the things we saw early on was that, even though there aren't really workable reimbursement mechanisms, digital mental health treatments are being implemented in the American healthcare system. And so we put together a work group to look at implementation and to try to understand what was working. And so we had representatives from 7 healthcare systems that had integrated digital mental health, and 10 digital mental health companies and other interested parties. We conducted interviews, and that resulted in a playbook that you can download from our website in kind of best practices based on what we've seen so far, best practices in implementation. And rather than go through, the details of that playbook, and I encourage you to download it and take a look at it, rather than go through the details, I want to go through an example of what I think was really a particularly well done implementation. So this was done at Reliant Medical Group, a healthcare system in Massachusetts. And so they already had a system where primary care physicians could refer into behavioral health, and then a behavioral health clinician would manage the patient's mental health care from there. So what they did was they contracted with about 10 different companies. And that's important because they're not relying on one digital mental health tool. They really created an ecosystem of digital mental health treatments. And then they assessed the person and they determined, if they were appropriate they determined whether they were appropriate for digital mental health treatment. And if so, which treatment might be the best. And they recommended that. And the person started, and they were assessed then for their every 2 weeks, they were assessed for, their symptom severity and whether they were improving. And a behavioral care manager monitored it, and if people weren't engaging, they would reach out to try to problem solve with them. If it wasn't the right tool, they would, offer them another one. And then really importantly, at 6 weeks, when you would expect a response, the behavioral health clinician had a conversation with the patient about how they were doing, and if they were not improve, if they were improving adequately, then they could continue, and if they weren't, then they would talk about the treatment plan, revise the treatment plan, maybe triage them up to a higher level of care like psychotherapy or reviewing their medications. But there was contact. There was a human in the loop who was managing the care process. And so this was a large pilot. So over 1,000 patients were offered digital mental health treatment. About half accepted, 38% registered, and 29% then activated and got started with the treatment. And that may sound like you're seeing a lot of drop off, but just to put that into context, when a primary care physician makes a recommendation for psychotherapy, only about 10% actually follow up on that. So this is a hard problem, and the success rate here is actually pretty good in the context of healthcare. And it was really very, very effective. So 3/4 of the people showed substantial clinical improvement. 22% had no change and were triaged up, along with 4% who showed some evidence of deterioration. So again, this is what you would expect to see with psychotherapy. Sam Nordberg, who led this project, I don't know if this has been published, but he's mentioned in webinars here at SDMH that they had around a $250 savings per patient. So along the lines of what's been seen before. So implementation is possible. So what have we accomplished to date, just to summarize? So we have really seen that digital mental health treatments are effective as a class of treatments. That doesn't mean research stops. We will continue to harness new technologies. Fine, there continue to be some problems that we have to deal with, developing tools for new populations, but as a whole, it is effective. And digital mental health treatments can be successfully implemented. It's not easy, but it can be done effectively. And when done effectively, it is cost effective. We certainly still have challenges. We have challenges with regulatory processes and the development of reimbursement mechanisms. I'm not going to talk about that specifically here, but I encourage you to, for example, with regulatory processes, today at 3 Eastern, there is a panel that will be discussing that, and we will continue to have webinars on that here in the society. But even if we, implement digital mental health, there still are going to be a lot of mental health care challenges in the system. People with mental health care problems are not identified adequately. Many go untreated and will continue to go untreated. Treatment is often suboptimal. Pharmacotherapy is most commonly delivered by clinicians who don't necessarily have specialized training in pharmacotherapy. There's a lot of variability in the quality of psychotherapy, and then care is fragmented. A physician makes a referral to a mental health service. The patient might or might not follow up. If they go to that service, they might or might not improve, and the patient is kind of left hanging in those situations. So these remain problems, but I think there are now technologies emerging that can help the entire healthcare system from pre-detection to assessment and triage, treatment, and then ongoing assessment and care coordination as well as operations. So digital mental health, I think we can begin to think about these technologies as encompassing a broad base of tools that can affect really every aspect of our healthcare system. And I'd like to now just take a few minutes to go through each of these stages in the care pathway. So at pre-detection, we have a lot of literature on using structured and unstructured EHR data, as well as other, potentially available data to detect mental health problems like depression, PTSD, ADHD, et cetera, mental health crises like suicide risk. And some of these are actually can be really quite good with, have high accuracy with areas under the curve of zero point 0.9 or better. And some healthcare systems actually are beginning to implement some of these detection tools. So once a problem is detected, there needs to be a more thorough assessment. And that can take a while, as you probably know, to get an appointment to do a broader assessment. And there are tools available today, computer adaptive testing. The first of those was the CAT-MH, and then what they call the kitty cat for children. And these are reliable and can be pretty brief, and they reduce the amount of time and burden. People can get access to it more quickly. They don't take that long. They increase standardization and precision. This kind of broad screening can catch misdiagnoses. But there are some concerns around black box scoring, loss of context, and qualitative detail. And some patients are reluctant to go through questionnaires when they're having a mental health problem. But there are also now companies that are starting to develop, AIs that can deliver this to create a more fluid interaction for the patient to make this a more acceptable interaction with patients. And then once the assessment is done, there has to be a decision about what treatment they're going to get. And the clinical decision support systems have been in place in medicine now for at least a decade, if not longer. And these tools use patient data to provide clinicians with evidence-based recommendations to optimize the treatment plans, tailor the therapies, and make triage decisions. And these tools are now starting to get developed and beginning to be implemented in some settings for mental health. And they can be cost effective. Importantly, they introduce standards and objectivity. They can reduce errors. And if implemented properly and discussed with the patient, they can support shared decision making. Again, there are some concerns, particularly as they begin to use AI-based CDSSs, there are concerns about transparency, and those kinds of concerns around transparency and AI, I think, are going to be discussed in a number of panels and presentations here at the conference today and tomorrow. We mentioned digital mental health treatments, and in terms of the delivery, these can be delivered in hybrid fashions. So, clinician plus an app is one form. Blended care models integrate digital mental health tools in the context of psychotherapy. So this is a method that's been used in the Netherlands, for example, in their rollout of digital mental health. With the hopes that it would reduce the amount of time that people need to be in psychotherapy. I'm not sure that's entirely panned out, but it is one model that's being used. And another is in the support of pharmacotherapy. So, Rejoin is a product that was recently approved by the FDA, and that is specifically designed to provide the behavioral health treatment for patients who are in pharmacotherapy. And then there are stepped care models, much like what Reliant used. So, beginning with a digital mental health treatment and then triaging up people who don't respond. And that's been shown to be non-inferior. That's a statistical jargon for it's pretty much the same as psychotherapy, and there are reduced costs. And then for the quality of behavioral treatments or pharmacotherapy that's delivered, there are, a growing number of AI fidelity monitoring tools. There's a lot of research on this, and now companies that are deploying this. And these use speech recognition, natural language processing, AI, to evaluate the competence and the adherence to protocols. And they can be used in training or to provide feedback and supervision to clinicians or for quality assurance processes. They can be used with therapists. They've been used with peer coaches to train them up and monitor the reliability of these. And they were initially started with, I think, motivational interviewing, and they're now tools for cognitive behavioral therapy. The reliability can really be quite good. So point eight, to put that in context, if you get a group of trained individuals, rating therapists, they get about a point 0.8, about 80%. Well, point 0.8 is about as high as you get with humans. So these tools are working as well as human review. Um, they have the potential to improve treatment quality and increase therapist efficiencies. They are generally accepted by patients. You get more resistance from therapists. Not surprisingly, most therapists are not all enthusiastic about having something monitor the treatment that they get. So how these are implemented and what the purpose is becomes really critical. And there's, some concerns have been raised around what's called goal fixation or displacement. So, essentially that's that, in these monitoring tools, you get what you're monitoring. So if they're monitoring for specific kinds of procedures, therapists and peer coaches will tend to focus their attention on those, and you sometimes see maybe a drop in some of the relational factors. So again, how these tools are implemented, they're very good at what they do, but how they're implemented becomes really critical. Um, and then for the ongoing care, right? I mentioned before that one of the huge problems in the American mental health care system is that it's fragmented, that patients aren't followed. And measurement-based care practices are, I think, really the answer. There's lots of different ways of doing that, collaborative care, integrated care. But they all are based on this idea that you regularly assess symptoms and response to treatment at fixed points in time. There is a discussion with the patient where the progress is reviewed, and if they're not improving, the treatment plan is adjusted, and then that process just continues until the patient reaches remission. Now that process has been around for 30 plus years. There have been tons and tons of trials showing that at a population level, it really improves outcomes. In fact, I would say that measurement-based care has stronger outcomes than any individual treatment by itself. It's an extremely powerful system, but only it's hard to implement, and only around 20% of healthcare systems in the United States have actually implemented measurement-based care because it is difficult. And here again, I think technology offers a lot of opportunities to improve that. So, on the assessment side, we can do automated, follow-up with patient-reported outcomes. And again, some people don't like answering questions, but there are now companies starting to develop more AI-based tools that create more fluidity in that interaction. There are tools for specific purposes. There was a company, I think, presenting here last year that uses speech and facial expression looks at those to identify tardive dyskinesia, a really bad side effect in for antipsychotics. The data there's a lot of research being done on using data from network sensors in phones and wearables and other devices to detect behaviors related to mental health, or cellularly enabled pill dispensers to monitor medication adherence. There's a lot that can be done here to facilitate measurement-based care. And then, of course, the clinical decision support systems that I talked about briefly. Um, On operations, there's also a lot, and some companies here have, in the past have presented on this. So AI scribes, these are being implemented, in medicine that can that can create the notes. So documentation support. They're efficient. Providers tend to like it because it cuts down on their time. It can frame the notes in ways that align with billing codes so that it increases the billing accuracy and increases the likelihood that the billing will be paid. Um, there's some, they do sometimes miss clinical nuance. There's a risk of hallucinations. They sometimes don't do a great job with risk assessment. So the notes have to be reviewed by the clinician, but it still takes a lot of the burden off the clinician. And then scheduling tools. For large organizations, scheduling is kind of a nightmare. And these kinds of tools can reduce administrative burden. They should reduce missed appointments and optimize provider utilization. So across the spectrum, there are a lot of, I would argue, digital mental health tools that can be used to improve the healthcare system. I think I talked about that. There we go. I'm not sure why this is going backwards. Sorry about this. Oh, I'm going the wrong way. That's why. Hitting the wrong button. So, um, so just to summarize here, digital mental health, if we define it broadly as the use of technology to support mental health care delivery, I think is going to have a profound and really transformative effect on mental health care in the coming years and decade. Um, and there are a lot of benefits to this. So, there's scale, so greater reach through improved detection and reduced barriers, speed and convenience that patients aren't, blocked for weeks at each step of the stage because they have to talk to a different person. There's efficiency and reduced per patient costs. We've seen that with digital mental health treatments. And the alignment of clinical documentation with billing codes should improve billing. There's standardization of assessments, of care pathways, decision support, and treatment fidelity to kind of standardize and improve the quality of care delivered, follow through and defragmentation. So, making sure that the care pathways are open, improving patient follow-up and decision support, documentation support to improve the work-life quality of clinicians. And then all of these tools provide data that can be that can be used for learning healthcare systems to improve the quality of care. But that's, if I went through this and you also felt a little bit uncomfortable, I also, as I've been thinking about this, also feel, a little bit uncomfortable. And some of these changes, are similar to changes that have already been occurring in medicine elsewhere, such as in primary care. And, there's some people have referred to this as the industrialization of medicine. And I think we do want to prevent the negative effects from happening in the mental health care system. So I want to spend a little bit of time talking about what the risks are and how we can potentially manage those. So I think a lot of the risks are in the implementation. So where incentives can be misaligned. So healthcare systems, they want to increase efficiency, but that can't happen at the cost of clinical integrity. So, we want to increase productivity, but, you can see in some of this, it might dampen or diminish the human experience, both the human experience for patients as well as for providers. Standardization, we know that done correctly, standardization can improve the quality of healthcare and mental health care for a population, but there are always going to be people who don't fit into that. And so having standardization, but allowing for responsivity to those who don't fit into that, either because like case management or people who come from cultures that are different or have disabilities that make it difficult to access. So ensuring that equity is there. There are the algorithmic risks and with generative AI, again, I know there are a number of talks gonna, here about some of the challenges with algorithmic risks in AI and bias that can be introduced in data systems, that are also aren't taking into account the differences of smaller groups of people. And then workforce and system problems like provider burnout. We do hear in primary care and other areas of medicine, physicians talking about it starting to feel like assembly line care. And we certainly want to prevent that in mental health where the relationship with the patient is really foundational. So, in mitigating that, I think, with human experience, the care pathway design is central, keeping a human in the loop, measurement-based care, much as I think, Reliant did a good job of this, making sure that there's a human in the loop who is managing the person, who is a contact, who can, shepherd the person through and kind of hold them through their mental health journey through the healthcare system. Technology and data, certainly data privacy and security, and having system, making sure that those are there, having audits when it's implemented to make sure that they're functioning properly and preventing inequities, workforce alignments, making sure that the systems support clinician work and support their development and doesn't become, essentially punishing, and having continuous quality improvement to identify problems as they arise in the healthcare system. So monitoring outcomes and safety and equity, patient and provider satisfaction, and importantly, unintended consequences like changes in the alliance between patient and provider, dropout rates, escalation rates. So how do we do this? Let me just say, certainly some of this has to be done by regulation, and the FDA, federal regulation unfortunately moves at a much slower pace than technological development, and there are now, I think, non-governmental entities like the Peterson Health Technology Institute reviewing treatments, CHI, which is, sort of, I think, attempting to develop what is it, AI labs for monitoring the effectiveness of AI. These kinds of non-governmental organizations that sit between the federal government and healthcare will have a role to play. And I don't want to get into that in this talk. I want to focus more on the front line where I think a lot of this is going to have to be managed. That is within the healthcare system. And most health, or I think pretty much all large healthcare organizations have some form of clinical integrity governance, and usually called quality departments. And so these departments, they manage patient safety and risk, clinical effectiveness, regulatory compliance. They conduct clinical audits and performance improvement, patient experience. They monitor patient experience, provider experience, and then manage data integrity and the integrity of data analytics. And they're often organized, in kind of a hub and spoke. So there's a leadership in the quality department, and then there are committees for example, data integrity, and then there are clinical service line committees. For example, typically healthcare systems will have one for pharmaceuticals and therapeutics, and often they'll have one for behavioral health. And for some reason, psychiatry is often outside of that, but there's often one for psychiatry. So there are service line committees. And, what I'm arguing is that, we're going to need to integrate, digitally enabled healthcare into those kinds of systems. And so the structures are there but have to be organized. So these clinical service line committees typically have, or they should have, broad and meaningful representation. So that includes providers, often patients, ethics, legal, data, IT. So a broad representation of viewpoints. And they have dedicated authority over care pathway design, staffing. They need to have authority over the integration of digital mental health tools into standard services, authority over implementation and de-implementation of tools that aren't working. tasked with monitoring patient-facing devices, so monitoring engagement, effectiveness, safety, equity, unintended consequences, monitoring provider-facing tools, often through audits like override rates for clinical decision support, bias and variance monitoring for these systems like the clinical decision support, assessment, fidelity tools, continuous quality improvement, and then having processes for allowing frontline clinicians to identify, escalate, and then ultimately resolve problems that are emerging. So the good news is I think that these structures that we need in order to mitigate some of the challenges of this integration and to facilitate the integration, the structures exist. Um, when I've talked over the last few months with a few people, leaders in quality departments at healthcare systems, they also identify a lot of challenges. The biggest one just being by bandwidth and resource allocations. So these quality departments, there is no spare time that people have to set up these systems. They are already completely overburdened. Their biggest requirement is mandatory regulatory reporting. So they're doing a lot just for their regulatory reporting, and then they're already tasked with monitoring all of the other systems that are in the healthcare system. So that's one. And the other is specialized knowledge gaps. So they don't necessarily have the metrics that they need for these digital mental health tools. They don't know what they are. One of the things that came out in these interviews with people is one way the thing that can be really helpful is when companies who are coming in actually have those metrics available and can say, this is how you monitor our product. These are the risks. This is how you monitor it. This is what can be done when these kinds of problems show up. So companies have a role to play in collaborating with quality departments to ensure that their products are effectively and safely integrated. The bandwidth problems, a lot of, they talked about, being able to extend or leverage external research grants to be able to implement these tools to develop the processes that they need. And there are a number of agencies that they work with in the federal government. And this process of leveraging these research grants can cover the bandwidth problem because they provide then the quality department individuals there with protected time. They can improve or fill the knowledge gap around data standards and implementation processes. So the Agency for Healthcare Research and Quality, AHRQ, they produce their mission is to produce and translate evidence that makes healthcare safer, higher quality, more accessible, equitable, and affordable. And they have periodically new RFIs, but like right now they have, they're looking for grants on AI integration, looking at, how to impactfully use artificial intelligence in the healthcare system. They have a series of grants that are come out every few years, developing centers for learning healthcare systems and, embedding scientists in that process. And that's, allows healthcare systems to build the expertise that they need for these systems. The PCORI, the Patient-Centered Outcomes Research Institute, one of their aims is to improve healthcare services like the coordination of care for patients with multiple chronic conditions, which most people with mental health problems have other healthcare problems as well, and so they have multiple chronic conditions, and these programs include system level, developing and implementing system level changes. FDA advances regulatory science, and so they fund projects looking at developing new tools, standards, and approaches to assess safety, efficacy, quality, and performance. And I was part of a unfortunately unfunded submission for a center grant that included components to do some of the kinds of work that I've talked about here today. And then for companies, helping to develop those metrics. There are small business grants, SBIR, STTR programs that can help companies develop those monitoring metrics. So let me just say, I think that there's a lot that digital mental health, really has the potential to transform all aspects of the mental and improve all aspects of our mental health care delivery system. And there certainly are risks, but I think the structures are there to mitigate those risks and to facilitate that implementation. And there are also avenues to be able to support healthcare systems in this implementation. So just to take a quick moment to talk about what SDMH is doing. So I mentioned earlier that one of the founding principles of the organization was to break down silos, to bring people from different stakeholder groups together to solve problems, and we have achieved that. I encourage you to come to the business meeting at the end of the day tomorrow, and you'll see that the breakdown of our membership is really pretty evenly distributed. Um, we have, a growing number of special interest groups. There's one for industry, one for equity, a new one for AI. There's a student SIG, and we certainly welcome SIGs from other constituencies. In terms of policy and uptake, we have a policy committee that's been, very, very busy. We have meetings once every 2 months now with about 20 or 30 other organizations, other nonprofits that are involved that, where their interests touch on digital mental health in one way or another. In those meetings, we share knowledge, and discuss emerging issues, and importantly, I think coordinate efforts. And one of the areas where we've done a lot of, been involved in efforts is in engagement with CMS around billing. I mentioned the implementation playbook with AI. Lisa mentioned the recent white paper on responsible integration of generative AI in mental health. We're exploring the development of agentic using, agentic benchmarking to be able to monitor AI tools for safety. We do a lot in education. This conference is a good example. We have a lot of webinars. We're looking at developing professional education programs. And I think we're in our second year of an internship program where we match graduate students with summer interns in companies. So with that, just to summarize, digital mental health, I don't think the question anymore is whether digital mental health treatments work. It is a class of interventions with strong scientific evidence. Implementation can be done effectively, and I think at this point we can begin to look at digital tools at a broader level that can support a range of functions in mental health care service delivery. And in doing that, I think we need to understand and begin to plan to address some of the tensions that may cause problems. And I see those as primarily tensions between healthcare systems' desire for efficiency and the need to provide quality treatment. So standardization, which is great for improving care at a population level, but we need to preserve within that responsivity to individual patient needs. Productivity is great, but we need to also maintain human connection and ultimately, balancing optimization with healing. And I think with the thoughtful implementation, we'll be able to ensure that digital mental health strengthens rather than diminishes the quality and equity of mental health care. So with that, thank you very much. And I think we have time for a few questions, maybe. I'll stop sharing.
Thanks so much, David. Yes, we have some questions coming in. And first, I want to address, we will be recording these sessions. Once they are available, we will let you know. So give us some time to edit and format, and we will keep you all posted. So please make sure you are signed up as a member or on our newsletter.
Yeah.
So one of the questions here is, where should therapists in private practice start if they're looking to implement some of these tools? Any place you recommend?
Well, I think I have a couple of thoughts about that. I mean, one is, you know, therapists, it's unclear to, there are lots and lots of different tools available. And so finding one, I think it's identifying what you need assistance with. So if you're talking about kind of patient-facing tools, um, identifying what it is that you need. I mean, is it that you want patients to, you want patients to record their mood or their symptoms and bring that back in, or do you have sort of specialized things that you want, like relaxation, for example, that your patient could use some assistance with. And so identifying what it is and then looking for tools. And there are a lot of really crappy tools out there. I think you have to do some research to make sure that they're safe, that they're not that they have privacy and security built in. And one of the tools for doing that, I think, is Mind Apps. I think it's mindapps.org. It's John Toros's website. He has, their group has reviewed, I think now about 600 different tools. So there's information that therapists can use to identify uh, tools that might fit, as well as do a little bit of investigation into whether they're safe. Um, and then, I think there's lots and lots of tools. I can't recommend any specifically, but there's lots of tools that will do kind of billing and that kind of, that kind of support to align bills if you're somebody who's referring to, trying to bill yourself. Most of what I've seen of those are being implemented in the context of care, like here in Chicago, in the Chicagoland area. Some of the community mental health centers have actually started implementing them to align the billing with, so that they can get better reimbursement from Medicaid. So those are often being used more at a system level.
Great. Thanks. So I know we only have a few minutes left, David. So, if we were having this conversation 5 years from now, so we're at our conference 2031, what would you hope has changed um, about how digital mental health is delivered and accessed?
Well, I'll go with the first big ones that I didn't talk about that I think almost everybody here in the conference would want to see, and that is that we have effective and workable, and underline workable regulation, because without regulation is really essential for trust in the system, of the tools that we develop, and that we have workable reimbursement processes. And I would hope that 5 years is enough, at least, to get some kind of workable reimbursement structures in place. Because companies, really, I think, I can't remember who it is, a colleague of ours said, companies are really on death row, and every time they get a little more venture capital, that just extends the execution date another year or two. But until we get that in place, it's not going to work. But I also hope that some of the tools that I described that can support measurement-based care start getting implemented, and that we start seeing measurement-based care become a bigger part of our healthcare system. Because I really believe that creating, systems that can support, or introducing measurement-based care in mental health is the single biggest thing that we can do to improve mental health care. And the challenge is, I do think that there are a lot of tools out there that can support that.
Well, that's great. So, David, I want to thank you for your time. And right now, we are going to take a break until 12:10. Join us at that time for our next session, Past, Present, and Future of Digital Mental Health, where we'll continue this conversation. For those that have asked about our in-person events, please look at our conference programming page. It'll tell you where our local meetups again are and what time. Um, and enjoy. Have fun. Thanks again, David.
Thank you.